All right, well, let's get started on our topic for today. So today is Qigong for depression, and this is a very important topic because depression is so common and it is so complex. It's really very important to have a broad understanding of the topic to know how to help people. As a Qigong therapist, I see so many people who have trouble with depression, and our goal is to help add to their wellness program, not to sidetrack them from what they're doing with Western medicine, but to really make it more comprehensive. Unfortunately, Western medicine is kind of limited with what it can do for depression. It's not limited because it has nothing to offer, but it's just not enough. Western medicine has a lot that it does put out there. For depression, it's just not even close to being enough. Depression is complicated because it can be difficult for people to even know for sure if they're depressed. They can have so many different kinds of symptoms. They could be having trouble sleeping at night. They don't know for sure that they're depressed. They could have exhaustion, fatigue, digestive, upset, anxiety, aches and pains, difficulty with healing. These are all things that go along with depression that can make it very complicated. Many people are on medication for depression, anxiety, taking meds that also cloud the issue because a lot of the side effects from antidepressants is actually more fatigue and lack of motivation. Unfortunately, despite the fact that there's so many different kinds of antidepressants out there, they're not happy pills. They don't make people happy, and people want to feel better, and the pills don't make them feel happy. Taking medication for depression can be very important in the process of helping with depression. What I usually tell people is that the antidepressant medications help the most if you are having trouble. Hi, Mariana. Nice to see you. Medications help the most with depression if you're having trouble getting out of bed, having trouble taking care of yourself, where you've kind of just, somebody has kind of fallen apart and they're no longer able to take care of themselves. They kind of are collapsed inward. They have trouble getting out of bed, trouble feeling like they want to eat. And taking medication can really help somebody kind of bring that low up a little higher so that then they can do some things to help themselves. But with more common kind of depression where it's not that severe, the medication is hard to even tell that it's helping, except for the fact that people just feel, better because they're doing something. And so they stop there. So they take an antidepressant, they don't really feel better, they just, are glad they're doing something, but their Western doctors don't know what else that person should do to help. Qigong is vital for helping with more common kind of depression because people need something real to do to help themselves out. They need to participate in their life and get more involved. And Qigong is a very simple tool that you can add in that can shift somebody's energy. So even when they're on antidepressants, the antidepressants can make them feel more tired, can upset their stomach, some antidepressants cause anxiety, so that it can still be very, very confusing. But when you add Qigong in to the program that somebody is on that includes taking medication, it can really help with the side effects of the medication, and it can help them to have a true shift in how they're feeling. So the person can still take the medication. They don't need to go off the medication. It's important that they understand that they don't need to change the meds that they're on. They can add Qigong in, and as they feel better, then they can take a look at those meds. I have so many clients who are taking medication for depression or anxiety, and they don't want to be on it because they don't like the side effects. And I don't rush to encourage them to get off the meds. I say, do these techniques first and move forward from there, and then you might be able to lower the dose. A lot of times, if the medication is a low enough dose, a lot of the side effects go away. So the worst side effects from meds are the first 4 to 6 weeks. So if you have a client who is recently, or you yourself have recently gone on medication for depression, give it a month, month and a half, and a lot of the side effects will calm down. But some side effects are persistent, and adding in Qigong will really help improve how you're feeling. So there are 3 different ways we look at depression from Chinese medicine: lung, liver, and kidney. Those are the 3 different angles. And sometimes people can have combinations of these organ systems out of balance. So lung energy is the energy that allows us to attach in healthy ways to other people and places and things. It allows us to attach and feel a sense of that those things belong to us, that we are part of that family, part of that business, part of that neighborhood. But it is also the energy that becomes challenged when we need to let go. So if people have had a loss in their life, they've lost somebody significant to them, they've lost a job, they've lost something that changes their lifestyle in a big way, then depression that relates to loss can be a result. And that is the lung energy. Difficulty adapting to the loss of something is lung-related depression. Difficulty of adapting to the loss of a person, a job, a location where you used to live. And helping the lung energy can help that person process the grief they are feeling from that loss. So grief is a healing process, and the lung is interwoven in that grieving process. So the normal grieving process takes time. This is really important to understand.